Thanks, Caroline. So everybody made it here, and despite the traffic. I want to welcome you all on behalf of the Department of Mental Health, where I've been in my new home or returned home for the past 5 months. And on behalf of DMH, it's a pleasure to welcome you all to the 8th Annual Suicide Prevention Summit. Actually, you'll be learning today up to the minute and state of the art ways to intervene around preventing something that's all too common in our society. We know that rates of suicide in this country are on the rise, now making it the 10th leading cause of death. We also know that those statistics for young people are even more concerning. Time doesn't permit me to go into all of the reasons why suicide might be on the rise, but let me tell you, there are far more than 13. Our department is proud to be at the forefront of supporting programs like this. Some of you may have read a recent LA Times article that highlighted and shared the message of unspent Mental Health Services Act funds. Not only in LA, but across the state, counties have really struggled to spend down some of these funds that should be supporting programs like this. But anyone who knows about the bureaucracy, how it can be at times well-intended, but misguided. But if you've spent any more than 5 minutes in a room with our director, Dr. Jonathan Sharon, you know that he has been a superhero on the mission to try to create a culture that changes how things are done, and I'm a part of that cultural change. Dr. Sharon knows that it's people like you who are in the trenches and who've had lived experience who can make for a better world and a better Los Angeles. Prevention is a key part of this, and it will be a drumbeat in the background as we all march forward doing our jobs to prevent unnecessary loss of life. I want to acknowledge the hard work of the organizing committee, including Carol Segusti and Caroline, who introduced me, and others. I know that there are people in the room wearing the green ribbons that helped to bring this great event together. Let's give them a big hand. So my relationship with suicide is a very powerful one. Prior to coming back to DMH in April, I worked for an agency that some of you might have heard of that had a powerful and fantastic presence and created many evidence-based practices to help those who were affected by and who had attempted suicide. During my 8 years as medical director at D.D. Hirsch, I learned firsthand about the devastating impact that suicide can have on the lives of others, including those who have survived and those who survive people who have died by suicide. Unfortunately, guilt, shame, and secrecy prevent many people from seeking the services and support that they need. Sparking up a conversation is key. We talk about preventing heart disease or diabetes, and we take good care to tell people how to take care of their teeth and how to get screened for various cancers. But we don't necessarily teach our kids about the benefits of being open about their destructive thoughts or their possible difficulty with coping with life's events. Around the dinner table, we don't often have conversations openly about depression or psychosis. Normalizing these conversations about mental health should be as normal as talking about healthy eating and exercise. Healthy coping is a key strategy to take this crisis head on. We should all be thinking about tools like our keynote speaker will probably talk about, the PSS-3, the patient safety screener, so that when we go to see our primary care physician, that a nurse or someone will ask us questions about, have we thought about killing ourselves, in the same way that a dentist would ask if you've flossed. We know that people who are suicidal frequently reach out to someone before they attempt. If you've ever heard a speaker named Kevin Hines talk about his experience after jumping from the Golden Gate Bridge, you know that there's this moment of regret that everyone who has survived, I think there are 9 of them who have done this, they talk about there was that moment when they wished that they hadn't done this. So there are places where we can intervene. And suicidologists talk about something called invitations, where people are open and they may be discussing it, but we have to be prepared to have those conversations. They're not easy, trust me. We also need to have not only a personal preparedness plan, but a plan to help people get to safety. That's what this day is about for you all, so that when a person approaches you in one of their darkest moments, you'll know how to intervene. Earlier this year, actually it was in January, I learned of a dear friend, someone who I spent a great deal of time with when I was a fledgling psychiatrist. And he would often open up to me about both his medications, his treatment regimen. This is what I used to consider an occupational hazard, that people share things with you. Well, unfortunately, when I went to San Francisco, I realized that he had fallen on hard times, that he had lost his job, and that he had resorted to some habits that weren't particularly helpful, like drinking. But as he was couch surfing and I was helping him to link to friends in the area that he might be able to get support and possibly some part-time work from, I was kind of hesitant to ask him just how bad things had gotten. Well, later, through social media, I learned that he had gone missing. And this individual was missing for several days. And at that point, the network began to rally around him. Unfortunately, it was too late. We learned that he had passed away by suicide. My heart sank. I was really troubled because I thought I had seen him just a few months before during my birthday, where we celebrated during a wine tour of Napa, which is when I recognized the drinking as being a trouble sign. But it was because of my own hesitancy and because of my busy life and living elsewhere that I didn't ask those questions. Are you taking your medication? Are you seeing anybody? I don't know if he reached out to anyone or if this was an impulsive moment, as it so often is, but I began to question, why hadn't I called to check on him? Why hadn't I, a trained professional, done more? And I'm sure that some of you who've had this experience have had similar questions. I thought, our society, we need to do better. I need to do better. Anybody, no matter how experienced you are, can always learn more. And anyone who's experienced such a loss knows firsthand how painful it can be. I challenge all of you today to take away some tools that will help you to transform not only the lives of others, but also your own life. So when I get those phone calls now from friends of mine who still come out and tell me about how they're feeling, I don't rest until I make sure that they're linked to a plan for safety. We need to make sure that we're reaching out to the most vulnerable, those who are forgotten, those who've been left on the streets of Los Angeles. There are 58,000 of them in our county at night. Those who are in jail cells, who don't have access to services that I would deem appropriate all the time. Those who are living in poverty, or the LGBT teen who's coming out to their parent or their foster parent for the first time. These are people that we know are at risk, people who are exposed to violence, trauma, and lack of social resources. These are the places where we all need to be. This is your conference supported by our Department of Mental Health. Thank you for listening, and I hope that you have a wonderful day of learning and empowerment, and that we all can put on our hero capes after this and go fight to save lives. Thank you so much for being here.
Thank you so much, Dr. Bonds, for that wonderful welcome and really putting a face of suicide prevention. A few more housekeeping things. For those who have requested a special lunch, vegetarian, vegan, and gluten-free, those box lunches will also be available in the Cabrillo during the lunch break. And if you need translation services again, please come to the front desk, and we have translation services available. I want to welcome another huge hero in suicide prevention, Stan Collins from Each Mind Matters.
Good morning, everyone. My name is Stan Collins. I'm going to be your MC moderator throughout the morning, so we're going to get to know each other pretty well. But I have the great honor of introducing Ellie Stout, the director of the Suicide Prevention Resource Center. And you can read all about her bio, her experience in the documents that you have in the program today. But what I wanted to share about Ellie's background, I've had the pleasure of getting to know Ellie over the last few years, working in the field together. We get together every year at the American Association of Suicidology Conference. And one thing that I just want to acknowledge about Ellie is that she is a hero of mine. A lot of times, people who work in this field come here for a variety of reasons. But for me, her passion has always been evident. And that's the type of person we want at the Suicide Prevention Resource Center. We want the person who takes this on their shoulders and realize that we all have a heavy load to lift, but it's going to be a lot lighter if we come into it together. So Ellie's going to introduce you to some of the larger framework, some of the, a lot of times we feel like we're flying blind when it comes to suicide prevention. And we forget that organizations like the Suicide Prevention Resource Center have taken best practices and research and some of the smartest minds in the field together and have laid out a foundation for us to follow, and they have laid out a blueprint for us. So Ellie is going to introduce you to some of those ideas. Afterwards, we're going to come back and I'm going to introduce you to some amazing people on our panel. So with that, please join me in welcoming Ellie Stout from the Suicide Prevention Resource Center.
Okay. It's a beautiful fall day in New Hampshire. A well-dressed woman walks into a gun shop. She comes straight up to the counter, points at a gun, and says, "I'll take that one." Now, I'm not a gun owner myself, but as I understand it, that's not how gun buyers usually purchase a firearm. They may have done some research in advance, but they want to hold the gun in their hand, get a sense of the weight, the feel of it. They want to know about features. They want to compare it to similar products. But she just points and says, "I'll take that one." The gun shop owner looks her in the eye and says, "Should you be taking that gun home today?" He bursts into tears. He takes her into the back room and talks to her and finds out that she was buying that gun to take her own life that day. But he is able to get her help, and she doesn't die that day. Two construction workers are on their lunch break at their work site. Charles and Bill. And Bill notices that Charles has been kind of quiet the last few days. So he asks, "Hey, buddy, is there anything up with you?" And Charles admits it's been really tough to make his mortgage payments lately. He's been having a lot of back pain, but he doesn't want to tell his supervisor. He doesn't want to take any time off to get it checked out because he really needs this job. And so he's been drinking away the pain most nights, and he's starting to feel really desperate. Bill tells him about a free case management service that's offered through their union that really helped him when he was going through some problems with his marriage. And he asked Charles for his phone. And Bill puts the number into his phone and hits call right there and then in their lunch break. Hands the phone back to Charles. And Charles is able to talk to someone, find some financial counseling supports, and also someone to talk to about managing his drinking. And he starts to see some light at the end of the tunnel. My name is Ellie Stout, and I'm so delighted to be here with you all today. And I want to tell you a little more about both of those stories today to help to weave a picture around some things that we have learned at the national level through work with many states, tribes, communities, campuses all around the country that will help make your suicide prevention efforts, no matter what your role is, more effective. The Suicide Prevention Resource Center is a federally funded project, so I have to tell you that my talk today does not represent the opinions of the Substance Abuse and Mental Health Services Administration, or HHS. Before I get back to our stories, I just wanted to tell you a little bit about the Suicide Prevention Resource Center in case you haven't heard of us before. We are the only federally funded resource center that's dedicated to advancing the national strategy for suicide prevention. And what that means is we're here to help all of you do the best suicide prevention work that you can. So we provide supports for states, tribes, campuses, communities, healthcare systems who are doing this work around the country. We also work with national partners who are also involved in suicide prevention, and I'll tell you a little bit more about our work with the National Action Alliance for Suicide Prevention in a few moments. But what I really wanted to highlight is that we have a website that is jam-packed with resources, toolkits, free online trainings, all kinds of information and resources to help you do suicide prevention work in your organization, in your community, in your role, and with the population that you're focused on. So I hope that you'll visit our website. I hope that you'll sign up for our weekly Spark newsletter that will keep you up to date on the latest news, information, resources, events, funding opportunities. So that's my little plug for SPRC. But let's get back to our stories. Oh, no, first, I'll tell you what I'm talking about today. So the 5 key things that will help make your suicide prevention efforts more effective are to start with your data, think systems, not programs. It takes more than one approach, take culture into account, and find your role, the theme of today's conference, and work with partners. So now let's get back to that beautiful autumn day in New Hampshire. And I want to tell you a bit about the New Hampshire Gun Shop Project, which is behind that story. And we'll go through each of the 5 key things for New Hampshire. So start with data. We all know that firearms account for more than half of suicide deaths nationwide. And in New Hampshire, that is the case as well. You see the blue bars here represent firearms deaths. So you can see they account for the majority of suicide deaths, especially among adults, which are the 3 bars on the right. New Hampshire also has a really unique relationship between their suicide prevention program and the state medical examiner's office. So when a suicide happens, when the medical examiner finds out about it, they find out about it. And they find out about some related circumstances to the extent possible. And 1 week in 2009, there were 3 suicide deaths, and all of the individuals who died had purchased their firearm at the same gun shop. So they went to the gun shop owner, who you see here, Ralph D'Amico, and they told him about this. And he said, I want to do something about this. This can't happen. I don't want my customers to die. I don't want my community to be at risk. What can I do? And that was the start of the New Hampshire Gun Shop Project. Think systems, not programs. Now I know when a lot of us start a new suicide prevention effort, we want to do a training, right? That's the first thing that people think of, and that's important. But Ralph knew that there needed to be more to it than that they really needed to bake in suicide prevention, so it was part of how his gun shop did business. So there was training, that is important. So the staff got gatekeeper training and resources, but also they got materials to post for their customers so that gun owners could be aware of the signs that someone might be at risk and also think about holding someone's guns for them if a friend or loved one was at risk while they were in crisis. There also had to be internal policies and procedures. Ralph was at that desk, that is a true story, when the woman pointed at the gun and tried to buy it to end her own life. But what about his staff? What should they do if they notice someone might be at risk? If they take someone in the back room, who covers for them? He needed to put in place some protocols so that they knew what to do if they noticed that something was a little off and someone might be in trouble. Part of that was making sure they knew who to call, connections with mental health resources in the community, and establishing those relationships. And then, of course, Ralph's own buy-in and support, his commitment and dedication to make this change in his gun shop was really critical. So it wasn't just the one training, it was a commitment across the system. It takes more than one approach. I'm going to pause here and tell you a bit about the puzzle pieces that you see here. This is part of the SPRC effective suicide prevention model, and this is the comprehensive approach to suicide prevention. So what you see here are different puzzle pieces that fit together to address different aspects of suicide prevention. And we know that this beige one, is it beige? Taupe, one in the middle about reducing access to means, that's what we're talking about with the Gun Shop Project, and that's very important. But on its own, it's not going to be enough to prevent suicide in a community. There need to be other pieces in place. And before I move on to the New Hampshire example of this, I did want to mention that there has been some recent data that came out from the CDC showing that over half of suicide deaths in our country are not, the person doesn't have a diagnosed mental health disorder at the time of their death. So mental health services are important, but we need to be thinking about other kinds of supports, and including things like community connectedness, life skills, and resilience. So different kinds of puzzle pieces work together to kind of wrap around a community. For New Hampshire, they didn't have all of those puzzle pieces. I'm not sure if everyone can actually see that. But they did, the New Hampshire Gun Shop Project was their central focus for reducing access to lethal means for people who were in a suicidal crisis. So it's temporarily keeping a person safe when they were in suicidal crisis. But New Hampshire is also working to improve suicide care in their behavioral health systems, their mental health, community mental health systems. So they're working to make some systems change there so that when people get referred to treatment, that they actually get the treatment that they need. New Hampshire also, for many years, has done a lot of work with the news media around safe reporting and trying to promote stories of hope and recovery so that citizens in New Hampshire feel empowered to reach out, as we just heard, that is so important. New Hampshire also trains a lot of different kinds of organizations and community members to recognize the signs that someone might be at risk for suicide and to know what to do, who to call, who can provide effective care and treatment. So again, making those connections. New Hampshire also has a very robust postvention response. Because they're embedded with the medical examiner, they know when there's been a suicide death in a community, and they're able to mobilize resources to support the community in the grieving process, but also support directly those who have lost a loved one or friend and more directly affected. And they've also been doing some work around crisis response, how to respond when someone's in an acute suicidal crisis. Hospitalization is appropriate for some people, but others may benefit from less intensive interventions. So how to do the least restrictive intervention that keeps a person safe while they're in crisis. Take culture into account. And this is where the Gun Shop Project kind of gives me goosebumps, because when I started in this field 11 years ago, you couldn't talk about guns. It was like a forbidden subject, even though we knew that guns were the means for many suicides. It was just such a polarized issue in our country, we couldn't even start the conversation. Public health people or suicide prevention people would say, guns, we need to keep people safe from guns, or we need to restrict access to guns, and gun owners would hear, you're trying to take away my guns. No conversation. And what was different in this story about New Hampshire is that a gun shop owner and a gun owner himself was part of leading this effort. And this quote from him, I think, says it all. He's like, it's not about pro-gun or anti-gun, it's about anti-suicide. And that's something we can all get around. The gun-owning community is at higher risk for suicide because they have access to a highly lethal means. So it was a community-owned initiative am I making those sounds? Okay, thank you. It was something the community could own and a conversation about safety, and that's why I included this brochure. On firing ranges, when you take a gun safety class, often people use the 10 Commandments of gun safety to try to reduce unintentional, like accidental injuries from the gun. And so they adapted it to add an 11th commandment about keeping people safe when they're in suicidal crisis. So again, talking in the language of the gun-owning community made it something that people could hear and take on as their own. And consequently, this initiative has spread across the country since it started in New Hampshire in 2009, including some local replications here in California. And in some states, it's been about the Gun Shop Project, sort of recreating that in a different state. In other states, it's been different kinds of initiatives with the gun-owning community. But what's really exciting is that that conversation, that dialogue, the language that they found to connect with each other opened the door. And 11 years since I started in this field, it's taken off, as you can see in the map. And it's so exciting because we're able to work together for suicide prevention and not let that polarizing debate get in the way of saving lives. Find your role and work with partners. So I showed you this sort of picture of what the puzzle pieces look like for New Hampshire. And certainly Ralph D'Amico and his gun shop were at the center of looking at access to lethal means for people in suicidal crisis. But he wasn't part of improving access to effective mental health treatment. He wasn't part of postvention necessarily. So I think you can see that many of you are in mental health. Maybe you see your role in a different piece of this puzzle. But even for the Gun Shop Project, it took a lot more than just Ralph and his gun shop. They were able to get other gun shops in the state on board, firing ranges. They got legislators to participate, as well as injury prevention, mental health, suicide prevention folks. So it really was a broad coalition that made this possible. Even just that one puzzle piece took a lot of partners, and that's what was able to make it successful. We'll just ignore it. So those are the 5 key things in New Hampshire for my story about the Gun Shop Project. And now I'm going to take you back to the construction worker who was struggling. And to tell you more about this story, I want to tell you a little bit more about the national level picture for suicide prevention and introduce you to the National Action Alliance for Suicide Prevention. The Action Alliance is the public-private partnership at the national level to advance the national strategy for suicide prevention. And the way I like to think about this is it's our national coalition. But we're really high-level folks from the different federal agencies who are involved in suicide prevention come together. Also leadership from national nonprofits that are connected to suicide prevention. And most excitingly, some private sector leaders who are newer to the table. So we have leadership from folks like Facebook and Johnson & Johnson, Union Pacific Railroad, Kaiser Permanente, the NFL. So lots of new sectors coming to the table to find out what their role is. How can they advance suicide prevention in their particular industry or area? Now, tasked with advancing the national strategy for suicide prevention is kind of a big ask because there are 13 goals and about 60 objectives in the national strategy. So it's a lot to do all at once. So where the Action Alliance has focused is on 3 strategic priorities that they feel will do the most to advance suicide prevention in the nation. On the left, you see transforming health systems, and this priority includes the Zero Suicide Initiative that promotes safer suicide care in health and behavioral health settings. It also looks at improving crisis services, improving care transitions between different systems, finding ways to finance suicide care, which is definitely a complicated question. So really looking at making sure that people at risk, when they interface with health systems, are getting the care they need no matter what door they come in at. On the right, we have changing the conversation. I mentioned that New Hampshire has done a lot of work, but also in California, there's been a lot of work with the news media to promote safe reporting and to advance those stories of hope and recovery. The Action Alliance is also working with the entertainment industry. So storylines, whether fictional or non-fictional, about suicide and how to sort of tell those stories safely and in a way that will change the national narrative. But it also has to do with all of us and how we message about suicide prevention. Are we telling a story of sort of inevitability and despair? Or are we telling a story of prevention and hope? So that's the shift that we're hoping to see, is more toward the prevention and hope with that priority. In the middle, we have transforming communities, and that priority has to do with recognizing that all prevention happens in communities, in counties, in cities, in towns. And that is where I want to focus the construction story, because under that, there is a workplace task force that is looking at suicide prevention in the workplace, which has actually been sort of a neglected area in suicide prevention until fairly recently. So, thinking about that task force, they started with their data, and the data is pretty persuasive. Again, sorry if you can't see this clearly. The graph on the right shows suicide death rates since 2000. And the green line at the top is adults between the ages of 45 to 65. So you can see that working age adult group actually has the highest rates and is also accounting for some of the big increases overall in our national rates. We know that men die by suicide at higher rates than women. So men are accounting for more of this general line that you see for those working age adults. We also know that compared with other occupations, the construction industry is a relatively high-risk sector. So there have been studies here in the US, as well as in the UK and in Australia, that show that construction workers have some of the highest suicide rates compared with other occupations. And there are some reasons that might contribute to risk for that particular industry. So there's shift work, which comes with lack of sleep. That's true for some other industries as well. There's a lot of physical injury, pain, chronic pain. And as you heard in the story, it's hard to keep your job if you have an injury. So many people work through that physical pain, and that also can have a psychological burden over time as well. There's also higher rates of substance use in the construction industry, in some cases to deal with that pain, that physical and mental pain. And also, construction workers often have to travel far away and spend a lot of time away from families, communities, so their social support network breaks down slightly when they're away on large construction projects. So based on this data, the task force created a special committee to look just at suicide prevention in the construction industry. Think systems, not programs. The construction industry is really complex. There are a lot of players. This is something that's relatively new to me as well. So there are the actual workers or the trades. That's the professions bubble that you see here. But there are also, those people may work for contractors. There are contractors that employ 3 people. There are contractors that employ 100 people. There's the financing area of who's paying for it. There's equipment. There are resources to be procured. And then, of course, the client who's actually hired everyone to build the thing. So the task force had to think about how to bake in suicide prevention, including wellness and mental health services, which are somewhat fractured across these different players, and really look at how to change the culture to embed suicide prevention in the construction industry. One of the examples that the task force looked at is a program called Mates in Construction. And I totally realize you cannot read the tiny words on this slide. Apologies. Mates in Construction is an Australian project that has actually seen some slight reductions in suicide deaths among construction workers in the parts of Australia that have implemented the program over time. And they are funded through a unique initiative that involves both unions and construction companies, which are usually at odds in Australia. They provide case management services that integrate any EAP services that might be available for a particular construction worker. They provide on-site support. They've set up a hotline that's not only for crisis, but also for case management. But I really wanted to talk to you about the box. You can't see it all. But hopefully you can see the 3 different colored circles. So this has to do with how they embedded suicide prevention among peers in the construction industry. So the white circle means you've participated in an awareness training, a general awareness training for all the construction workers at a particular site. The green circle means you are a helper. They call it a connector. And that means you're somebody who's received some additional training, some gatekeeper training, to support people who might be struggling. And then the blue circle means that you've been ASSIST trained, which hopefully many of you have heard of ASSIST. That's a 2-day gatekeeper training that provides some additional skills. So these circles are stickers, and they go on your hard hat. And when you go to a new construction site, because you don't always work with the same people at every site, you take your hard hat with you. And if you have a green or a blue sticker, people who have gotten that awareness training know that you're a peer they can talk to, and you can help them if they're struggling. And so it's a really cool way to embed and bake in suicide prevention across different construction sites that ebb and flow. Some are big, some are small. You're working with different people from different trades in each site. It takes more than one approach. So you've seen these puzzle pieces from SPRC. The task force actually came up with their own puzzle pieces. This is their broader workplace suicide prevention model. And then they translated it a little bit differently for the construction industry. This graphic is my own, but what they did was sort of group it into upstream, midstream, and downstream so that they emphasize that you're starting with mental health promotion, life skills, social networks. You're starting with building strong workers. You're also having services for people who are at risk, for people who are thinking about suicide. And then you're also responding to crisis, responding after there has been a death. So it's really comprehensive, the puzzle pieces that they came up with for the construction industry that they're trying to promote. Take culture into account. So the construction industry isn't, all of those different players, they're not traditionally thinking about themselves as suicide prevention people. And so like the New Hampshire Gunshot Project, but on a different level, we have a leader from the industry. The man you see here on the right is Cal Beyer, and I cannot remember. He is the Director of Risk Management for Lakeside Industries, which is a large asphalt paving contractor in the Pacific Northwest. So risk management in the construction industry has to do with minimizing the different kinds of risks entailed in any construction project, and each one is different. They're different risks. And so Cal Beyer began framing suicide as a project risk that the industry couldn't overlook, as a responsibility that people like him in the industry who were looking at risk needed to take into account. So he started talking about this to his peers in risk management, and he wasn't putting articles or talking to reporters for USA Today or the LA Times. He was talking to trade journals. He was talking in the language of his peers, and he was getting it into a message that his peers could see, the regular trade journals that they read. And he also engaged his national association, which is called the Construction Financial Management Association, in creating their own initiative for suicide prevention, which I'll tell you about in a moment. But again, speaking in the language of the industry and having a peer from within the industry lead the effort made it more credible and allowed it to take on the momentum that it has. find your role, and work with partners. So I mentioned this Construction Industry Alliance for Suicide Prevention that was started, sorry, I can't ever remember the name of it. Construction Financial Management Association started. So basically, the construction industry took on ownership of suicide prevention. And these are just some of the partners, both in suicide prevention, but also construction industry partners that have come together in this alliance. I could not fit all of the logos on one slide here. So it wasn't just Cal Bayer. It was all of these people coming together and taking on the ownership, and it was him who started the Spark, but this group is moving it forward. The Action Alliance is now a member of this group, but no longer sort of the only one out there promoting suicide prevention in the industry. So, start with your data, think systems, not programs. It takes more than one approach. Take culture into account, and find your role and work with partners. And you may be thinking, well, I'm not a gun shop owner or a construction industry magnate. How does this connect to my role, to my setting, to my community? And the good news is there are a lot of resources, many of which you can find on the SPRC website, that are specific to your role, to your community, to the organization that you work with, that can help you put these things into practice in your suicide prevention efforts. So I'm going to tell you a little bit about them. Don't worry about writing everything down. We are going to follow up with some links to some of these resources, but know that most of them you can find on the SPRC website as well. So start with your data, and I did take a peek at California first. It's I bet they have some data available. This graphic here is a screenshot from the Department of Public Health Epicenter, where I found that you can run reports on suicide by county. That's the screenshot that you see here. So I encourage you to check that out. You also have some other sort of statewide surveys going on. But LA County, I found out, has some really great resources, including a child death review team for the county. And that team looks at every child death up to a certain age, and they do a report annually. And I found there's a 2017 report. So they're looking in depth at youth deaths, including suicide deaths, and all the circumstances around them. And their mission is to provide that data to inform prevention. So if you're interested in youth suicide prevention, I would check that out. SPRC also has some resources, and I'll just highlight a couple. I mentioned we have free online trainings. We have two that relate to data. One is how to find the data from different national databases, and one has to do with using the data in your strategic planning. So how do you take that and translate it into prevention? We also have a newer series of surveillance success stories. The one that you see here is from the California Department of Corrections and Rehabilitation. And those are stories of how communities and systems figured out cool ways to get access to suicide data that isn't always available from traditional data sources. Think systems, not programs. And the good news here is there are a lot of different resources about how to make change in different kinds of systems. Perhaps the most known at this point, at least at the national level, is the Zero Suicide Model. And that is a model for systems change in health and behavioral health settings to provide safer suicide care. So that's what the image you see here on the side. But you may not have known that we also have toolkits for primary care practices, for high schools, for senior living facilities, for juvenile justice settings. So there are a lot of established resources that look at what are the different pieces of the system and how can you really bake in suicide prevention to that particular setting. It takes more than one approach. And again, you see the SPRC comprehensive approach here, and that is on our website. We have information and resources about each of the different puzzle pieces available. Also on the left, you see a screenshot from the CDC technical package that was released last year, focused on suicide prevention. And a technical package for the CDC is where they look at all the evidence, and basically they've summarized their own puzzle pieces, as it were, the strategies that you see there on the left. And they crosswalk pretty well to our puzzle pieces, but that represents the latest review of the evidence on what strategies work for suicide prevention. And again, they have to be used in combination to be most effective. Take culture into account. We worked a couple of years ago with CalMesa to create this resource that you see here on creating linguistically and culturally competent suicide prevention materials. We know that linguistic and cultural competence is more than just translating word for word. We know that it has to do with making something that's really tailored for a different culture. And we drew on a lot of examples from California, or CalMesa did, and provided a framework for how people can do that kind of translation, effective translation, in other states. So I encourage you to check that out. We also have a lot of resources for specific high-risk populations on the SPRC website. And finally, find your role and work with partners. And I know finding your role is the theme of this whole day today. But working with partners is important because you can't do it all on your own. And there are resources on building those relationships and thinking about what kinds of partners that you might want to engage. So the National Strategy for Suicide Prevention for each goal outlines different things that different kinds of players can do to advance that particular goal. There's also a report from the Action Alliance around transforming communities that provides an enormous laundry list of everyone you might want to involve at the community level and some guidance on how to do that, and also highlights some examples of how that's been done successfully in other communities. And the visual you see here is from a virtual learning lab that we have on the SPRC website. We initially designed it for states, but I think it would be very relevant at the community level as well, where over the last 15 years, working with states and communities, we identified the sticking points, the barriers that you can run into when you're building relationships with new partners who may not see themselves as suicide prevention people yet. So you can kind of zoom in on the particular barrier that you're hitting and find resources, ideas, examples, case studies to help you get through that particular barrier. And almost all of these resources, with the exception of the California data sources, are available on the SPRC website. So again, I encourage you to go and explore. You can find the population you're interested in. You can find the setting that you work in. We have a series of customized information sheets where you can find your own specific role. I'm a school teacher. I am a foster parent. So I encourage you to check it out. And I am early. We'll catch up a little on time. But to sum up, start with your data. Think systems, not programs. It takes more than one approach. Take culture into account and find your role and work with partners. And these things should help to make your suicide prevention efforts more effective. But what's most helpful is your passion, your dedication. And I want to thank you all for the important work you do every day to advance suicide prevention in your community, in your setting, for being a voice for suicide prevention. And with that, I'll end my talk and let you hear from some folks in your own area who are doing really great work as well. So thank you.
Good afternoon, or good morning. It feels like afternoon. Good morning. Thank you very much, Ellie. Great job. So before we get to the panel, I've been asked to share a story with you, and I'm going to see. Maybe I'm not going to be able to move with this microphone. Again, my name is Stan Collins. I'm part of the Each Matters resource navigation team, and I don't think I'm going to be able to move with this thing. Sorry, one second. All right, so many of you don't know me. Some of my good friends, some of my heroes, some of my mentors are in the room. But I wanted to bring it down from that national perspective for us today. So I've been working in suicide prevention now for about 20 years. And believe me, I'm the last person that I would have ever thought would be standing on a stage here today saying that I work in suicide prevention. I grew up down in San Diego. That's where I currently live. And it's been an honor working with the LA County team and all the wonderful organizations and partners we have here. But I want to share a story about why I do this work. Because that's the most frequent question I get from people. Why the heck would someone choose to spend 40, 50, 60 hours a week thinking, talking, writing about one of the darkest things that we go through as humans? So I'm going to go back to my freshman year in high school. I had a good friend of mine named Jesse. Now, my older brother and Jesse's older brother were best friends. And so growing up, me and Jesse got to be close. We had what I would call an arranged friendship, because anytime our brothers went somewhere, our mothers would throw us in the backseat of the car, and if they were going to the beach or to the movies, me and Jesse were tagging along. And me and Jesse were very different people. Jesse was kind of a tough guy, ran with a little bit of a rougher crowd. And my freshman year in high school, I weighed about 100 pounds dripping wet. I was a nerd before Comic-Con was cool. And I idolized Jesse. I absolutely just gravitated to him because he was a year older than me. And so I thought he had the whole world figured out. And so my freshman year, I was blessed because me and Jesse had the same fourth period geometry class. And so every day my freshman year, I knew that there was at least 1 hour of the day that I could look forward to, 1 hour where everything was going to be okay. Me and Jesse, our last names were similar, so we had our desks right next to each other. And every day we'd sit in that geometry class, we'd go to lunch, a couple more hours, and the day was over. But one night I came home from practice, and I was walking down the hallway of my house. And my older brother was coming towards me, and he had tears in his eyes. And I should preface that my brother is a law enforcement officer. I come from a family of cops. My mom, my dad, my brother, aunts, uncles, grandfather, everybody. And needless to say, me and my brother are at different ends of the emotional spectrum. This is one of 3 times in my life I'd ever seen my brother cry, whereas I cry at Hallmark cards and Disney movies. And so I knew that this was one of those moments that we've had in our lives where everything slows to a crawl, where we know that there's a fork in the road that we have absolutely no control over. And I went up to my brother and I asked him what was going on, and I'll never forget how he said and the words that he used when he went on to tell me that Jesse had died by suicide. And I remember the weight of the world hitting me with those words. I remember stumbling back until I hit the wall. I remember sliding down and putting my head between my knees and crying for hours. And for those of you who have lost someone to suicide, and I know I'm not the only one in the room, it was every emotion in the world. It was confusion, anger, sadness, guilt, shame, and you can't even hold on to one emotion long enough to process it before the next one punches you in the face. I was confused. As a teenager, I was 14 years old. I was talked to about sex, drugs, and rock and roll, and the one way that one of my best friends died is something that no one ever talked to me about. I didn't understand at that point in my life, how does someone get that lonely? How does someone get to that much pain? I was angry, and this is something that an emotion that we as loss survivors don't get to share that often because it feels horrible, but I was angry. I was mad at Jesse, thinking, how could he do this to me? I was sad. But one of the issues about losing someone to suicide is we don't just get to be sad that someone died. We have to be sad because someone died by suicide, and that brings in the guilt and the shame. I had seen Jesse just 3 or 4 hours before he died. If I was such a good friend, why didn't I know that this was coming? Why didn't we have a conversation about this? Why had we never created a space? Why did no one ever give us the skills? And this is one of the greatest disservices we do to young men is we don't teach them how to create that kind of space, to have that kind of conversation, to ask for help. The next morning I was getting ready for school. My mom caught me as I walked out the door and she said, honey, you don't have to go to school today. It's okay. And I said, no, I'm going to go. And I couldn't figure out, but I was so determined. I am going to go to school today. And I got the answer why when I walked into my fourth period class, because I realized there was a part of me that thought that Jesse was going to be there, that this was all a bad dream, that I was going to walk in and Jesse was going to be there and everything was going to be fine. But what happened that day and every day for the rest of that semester, every day for the rest of that school year, is I sat next to my best friend's empty desk. And one of my passions is working with youth-based suicide prevention, is helping schools learn how to respond. But this was back in the mid-90s. This was in the dark ages as far as school-based suicide prevention is concerned. Nobody knew what to say. I didn't have a single adult come up to me and say, "Are you okay?" Now, if Jesse had died in a car accident, if Jesse had died of an illness, I would have been wrapped around with support. But there I was, a 14-year-old boy with no one to go to, not knowing what words to use. And unfortunately, I ended up sitting with that silence for a few years until my senior year of high school. I mentioned my father is a law enforcement officer, and he was working on something called the Suicide Homicide Audit Committee, where they were going back and they were looking and trying to figure out what was going on. And he had heard about a program called the Yellow Ribbon Suicide Prevention Program. And he asked me if I wanted to come do a presentation. And for me, I was in peer counseling. I'd lost a friend to suicide. I was excited for the first time in my life. I was now 17 years old, and for the first time in my life, I heard the word prevention attached to the word suicide. And so I went to the presentation, and I walked away feeling so empowered. I thought, man, if maybe I'd known this, maybe Jesse'd still be here. If Jesse had heard this message, maybe Jesse would still be here. But what I do know is that everyone in my school needs to hear this message, because I don't want anyone to go through what I went through. And so I went back the next day to my principal, and I had a packet of information. And I went to him and I said, "Hey, we need to start this program." And he looked at me and he said, "Hey, Stan, come back in a couple days. I'll look through the information. We'll see what we can do." And so I came back a couple days later, and I walked into his office, and he looked at me and he said, "You know, Stan, I got really busy. Come back in a few more days and we'll talk about it." So I came back a few days later, and I got the same response. "Stan, come back in a few more days and we'll talk about it." And we did this dance for a few months, to be honest. Until finally one day I walked into his office, and I don't know if I caught him at the right time or the wrong time, but regardless, his reaction was, "Look, Stan, I trust you. You're a good kid. If you think this is something that we need to do, you go out, you raise the money, and we'll make it happen." And so I went out and I raised the money, and we flew the founders from the Yellow Ribbon program out, Dale and Daremi. They had lost their son a couple years before to suicide. And as we used to do, and hopefully any people in education right now are not doing this anymore, we actively tell schools not to do this now. But we gathered all 3,000 students into the gym to have this very intimate conversation about suicide. And about 5 minutes before the founders were going to speak, they looked at me and they said, "Hey, Stan, have you thought about what you're going to say?" And I freaked out. I froze. I was like, "Hey, I did all the work. I got all the people. If you build it, they will come. They're here. This is your job. Do it. This is your guys." And they said, "You know what? Your classmates, they should hear from you." And so I went through my head, what do I say? What do I do? And I remembered that I had written a poem in memory of my friend Jesse. It was the first time that I'd actually expressed emotions about the whole thing. And so I went into my backpack and I dug it out. And so now here I am, my senior year in high school, in front of 3,000 of my classmates. I'm talking about suicide, and now I'm reading a freaking poem for everybody. And I am just mortified. And I'm thinking to myself, what were you thinking? Why did you think this would do any good? And I stumbled through the presentation. I'm sure it was a complete mess. I went home that day and went immediately to bed, just trying to forget that this had ever happened. And the next morning I woke up, and honestly, as I got ready for school, I was getting ready for battle. I thought I was going to go to ridicule and just an onslaught of just whatever comments. And as I was walking onto campus that day, the attendance lady has a window that faces the front of the school so she can greet people, as kind of keep an eye out. And we made eye contact, and I saw her immediately walk out the back of the building, and she started making a beeline towards me. So now I'm freaking out because the attendance lady is making a beeline right at me. And I noticed she has an envelope in her hand. So now I'm a little bit more concerned. But she comes up to me, and I remember these words. I'll never forget them. She reaches her hand out, and she says, "Stan, I have a gift for you." And I open up the envelope, and it's a letter from a girl named Sarah. No last name, no last initial. To this day, I'm still trying to find Sarah. I'm hoping, if Sarah's here, please tell me. I'm hoping one day if I tell this story enough that Sarah will be here. But in the letter, Sarah went on to tell me that she'd been thinking about suicide, that she'd been thinking about ending her life for a long time because of all the pain that she'd been experiencing. She was actually thinking about killing herself yesterday. And she happened to show up on a day where for the first time in her life, she heard someone else talking about suicide. And that poem that I was so embarrassed about reading, she told me that kids had made copies of it and they had spread it all around campus. And she told me that she had posted it right next to her bed and she was going to read it every morning to remind her of her reasons for living. And I want to pause on that thought before I finish the story. For a long time in suicide prevention, I thought that suicide prevention was about convincing people not to die. And if you came to me, a quote-unquote, subject matter expert, and you said, "Hey, Stan, there's a guy in the hallway who's thinking about suicide. Can you go prevent that suicide?" To be honest with you, I would freak out. But if you came up to me and you said, "Hey, Stan, there's a guy out there who's not sure whether or not he wants to live. Could you go out there and talk to him and maybe help him find some hope?" Can you go out there and talk to them and maybe help reduce that pain a little bit? Can you go out there and maybe help that person find a few reasons to stick around for a little while? I think any of us would say, all right, I can do that. Suicide prevention is not about convincing people not to die. It's about helping people find reasons to stay. And she went on her letter and she thanked me for sharing my pain. And she thanked me for sharing my hope. And I want to pause there too. And this isn't research-based. This is just my own opinion after working in this field for 20 years. That in my opinion, when you reduce suicide down to two of the most basic factors, it's about pain and hope. And many of the suicides that I've experienced, many of the situations around attempts, people thinking about it, simply come down to pain outweighing hope. But it's my belief that hope is greater than pain. And in that conversation or in that letter, she went on to thank me for all of this. And she basically closed the letter by thanking me for saving her life. And I share this story with you, yeah, it's a pretty extraordinary story. What are the chances that my very first presentation, I get this letter that there's this girl there in that room? But I share this story with you today, and I share it in a lot of my presentations because I don't want anyone in this room to ever underestimate the role that we can have in helping remind somebody of their reasons for living. And I hope that through the course of the day, you will embrace that. And I hope that you will also walk away with tools that you will be able to help convince other people that every one of us has a role to play. And every one of us can be that link. For a long time, we thought that if someone was suicidal, we would wrap our arms around them, we would pass them to somebody else, they would pass them to somebody else, and eventually there would be this magic leprechaun at the end of this chain that cures suicide. And that leprechaun doesn't exist. And every one of us, every link in that chain, from the teacher who recognizes the warning sign, to the counselor who has the conversation, to the first responder who comes and does the assessment and does a determination of transport, to the initial healthcare provider or nurse that's in that hospital, from every single person is an opportunity to inject a little bit of hope and an opportunity to turn the dial down on that pain just a little bit. So again, I hope through the course of today, you will walk away not just more educated, but that you will also walk away more comfortable in acknowledging that everyone has a role to play in suicide prevention. Now with that, we're going to transition to the panel here in just a few minutes. And I just want a quick show of hands. Mental health professionals. How many in the room? Excellent. How many people in education? All right, excellent. I know we have some law enforcement officers that are represented, some community-based organizations, and the list goes on. But, just some things to think about. A lot of times we hear that for the suicide prevention field for years, we've said everyone has a role in suicide prevention. And what we wanted to do with the conference this year is, that sounds nice, but to be honest, it's kind of vanilla. Because, okay, everybody's got a role, where do I start? And today we're hoping that you're going to walk away, if you don't already know what that is, that you're going to be able to, again, not just find your own role, but help others find their role. If you work in education, if you're a teacher, you can ask what your district is doing. If you're working at the district level, you can make sure that every staff member within your district knows the protocols, knows the policies, knows who to call. As simple as giving them a one-page document that say, hey, if you're ever worried about a kid, these are the people you contact. If you're a law enforcement officer, looking at what trainings has your department or your agency gone through. Have you been trained in how to do a risk assessment? If you're not going to transport the person on a 5150, what other resources do you have before you leave the scene that you can get that person connected to? If you're in healthcare, again, asking what assessment tool are we using? What are our protocols? If I'm in a primary care setting, what is our process? Who's going to be the person that's going to make those phone calls? And I hope that each of us can go back today and be a little bit more critical. There's something that I say when I work in schools, and I ask them, and I'll just ask you all, how many of you have ever participated in a fire drill when you were in school? Every one of us, right? How many of you were actually in a school that was on fire? That's a big audience, not one maybe one person. For some reason, in suicide prevention, we have felt like we need to convince people that we should be doing this. We need to demand that we're doing this. We need to stand up, and again, as I said earlier, we're not flying blind. We have tools, we have resources. We have an army of people in this room who are ready to get out there and do the good work. So with that, I'm going to ask my panelists to come join me. I'll introduce each of them as they come onto the stage. We're going to sit down. We're going to have a little conversation. But with that, thank you very much for your time, and we're going to get the panel settled, and we'll be right back. Thank you. All right, so I'm going to just direct you. You have a one-page document in your program that has just a brief overview of our panelists. I'm not going to go through and tell you each of their stories up here. I'm going to sit down with them, and we're going to have a conversation. We decided to do it this way. I hope everybody's going to be able to see. If you need to adjust, please do so as needed. I'm going to start and just introduce, and then I'm going to sit down and join him. Immediately to my left, Miss Ann Taylor. Next to her, we have Melvin Jackson Jr. Next to him, we have Officer Stacy Creech. At the end, we have Reverend Alice Parsons-Zula. All right, great. So we're going to sit down. And also, I want to mention that there are note cards that are going to be passed around or have been passed around, sitting on the center of your table. So if you have any questions for the panelists, for myself, you have one right now. I thought that earlier, and I can't. I was told not to. I did ask. I acknowledge that. I'm sorry. We'll do our best. But I want to sit down so that you at least can see everybody here on the panel. So, all right. Well, I apologize. We have seats right here in the front if anybody wants to move up. Come on down. Yeah, come be this. Let's all be one big family. So you have cards there. If you have a question for any of the panel, just go ahead and fill it out and just raise it up. Tracy and some other members of the Planning Council will come around. They'll grab them, and we'll try to get to as many questions as we can. All right, so with that, Officer Creech, I told you I was going to put you on the spot first.
I'm terrified to turn this on, though.
Oh, yours isn't on yet.
You're good. You're good.
Are you sure?
Do it, but be ready to.
Everybody cover your ears.
You're good. There you go. Boom.
We're all right? Do a quick check.
Hello.
Perfect. All right. So a lot of times law enforcement, when we think of law enforcement and suicide prevention, we think of you as the ones who come to just handle it. We don't know what to do. This person needs to be transported. And that a lot of times is the role that law enforcement ends up playing in suicide prevention. Although that's an important part of it, you kind of came to this from a different angle. So what made you kind of step above and beyond what law enforcement is typically seeing? You had some experiences, you noticed some things, and you decided to do something about it. So could you talk about that?
I did. Can everybody hear me? Okay. Whew, I'm still shaking from the little feedback there. We get a little jumpy. I almost have to say that the time frame that I have, and I apologize, I lost my voice over Fleet Week. The time frame that I have on my, I guess, little bio thing is actually a little bit farther out. It's probably about 2012. It was actually another Fleet Week event we had, and I was pregnant at the time, so I wasn't able to be a part of the patrol, and I was sitting in the command post, and we got a call about a jumper on the bridge. Now, I work down at the Port of Los Angeles, for those of you who haven't read that, and we have the Vincent Thomas Bridge down there. It's not necessarily known for the frequency of people that may come to take their own lives, but we've had our fair share. And that particular day was a day that Tony Scott jumped from the bridge. And it got me thinking, why don't we have signs up there? Why don't we have more that we can do to try to prevent that from happening? And so I started my internet search. And a trip to San Francisco led me to some of their officers up there that are there specifically to monitor cameras and look for signs, anything that would point them to look at someone that may be up there to do more than just sightsee. And I found a couple numbers, and I started calling these numbers. And I said, hey, I'm not trying to do anything. Don't be alarmed. I'm trying to get in touch with somebody that can help me bring that program or something very similar down to the port. And so eventually I got connected with a very fabulous woman you'll hear from later, Sandra Kramer. And she helped me finally get in touch with someone that could help me get that started. I know you kind of wanted to go into some other stuff, so I don't want to keep going. Okay. So I tried several different, and I'm not bashing on any agencies in the city of LA. I tried getting in touch with several people in Caltrans, CHP. It was just hard to lock somebody down. everybody's busy, everybody has something else to do. But eventually Sandry got me in touch with this guy in the back, Jeff Newman. Fabulous individual, very good about returning phone calls. Big key. And we finally got to sit down. We had a meet and greet. Things started happening. They showed me other projects that they had done with Metro and all kinds of other public transportation. And I thought, man, that's great. This is what we need up there. So we started moving in that direction. We also did some assessments with maybe some structural changes that we can make to the bridge to help limit the availability of the bridge to people, the areas where they could maybe get through the fence or something like that a little more. And then I reached out again to Sandry, and she mentioned that they come out and do a lot of training. And I said, great, let me get my captain on board. So I sat down with him. I said, hey, listen, this is something we got to do. We've got to get everybody on board. We've got to get people to recognize the signs. You know, we get a lot of phone calls or radio calls about pedestrians on the bridge. Now, if any of you are in the San Pedro area or have crossed that before, there's no sidewalk. Pedestrians aren't allowed. So every time we get that call, you think, is this another one? It's always a code 3 response for us. We get there as fast as we can. And our boat units will respond down below, hoping that we don't find anything down there. Tony Scott wasn't the first, and he hadn't been the last. But I feel like we're moving in a direction to try to prevent that from happening again. So that's kind of my story.
Well, I want to talk a little bit about the trainings that Sandry and Dee Dee Hirsch brought to you, because I do a number of trainings with law enforcement, and I have the unique perspective, like I said, of coming from a law enforcement family. But one of the things that, what do you think is one of the most important things that officers need to be trained on? Obviously, warning signs and risk factors, but what do you think is one of the most important things that officers can kind of be raised the level on?
A lot of it is the mental health training. So much of it comes down to, you know, we can't get inside anybody's head. There's movies, but we haven't found anything that can literally tell us what somebody's thinking at the time. And I think a lot of situations and people that we come across with mental health issues that maybe aren't getting addressed, and they're living out on the street too, those resources they're not coming out to them. Maybe they don't have a way to reach out. And so I think to train our officers in the resources that these people in crisis or other mental health issues can find what they need to help them get to a better state.
When I was creating a training down for cops in San Diego, one of the other items that you hear people talk about is that suicide is towards the top of the list as far as causes of death for law enforcement officers themselves, and yet there is this wall of emotion that a lot of officers that I work with and know kind of put up between this kind of us versus them mentality, like, no, we can't be at risk of suicide, and yet many agencies have seen and continue to see deaths by law enforcement. Is there anything that you think that law enforcement agencies could be doing to better take care of their own in regards to suicide? Because I hope I don't offend any of the law enforcement officers in the room. And again, I come from a family of them, so I'm kind of okay to do this, maybe. But when I was asked to create the training, they wanted it initially for the law enforcement officers for their own well-being. And when I talk to officers, they say, if you come up to us, I'm just gonna, plug your ears, be ready to run. But they said, if you come to us and talk to us about mental health, you're gonna lose us almost immediately, about our mental health. And so the analogy that I use that's gonna offend any law enforcement officers is that, how do you give a dog a pill? You hide it in a piece of cheese. And so by educating them about community-based law enforcement or about community-based suicide prevention, what to look out for, what to say, what to do, what are the resources. I'm gonna switch. Or maybe I'm just cursed. No, I think it's all right. Okay. So what can law enforcement departments be doing to make sure that their own officers are receiving that message? Because anytime I come in for a training, I inevitably get 4 to 5 totally inappropriate comments from law enforcement officers prior, like right as I'm about to start. But what can they do to better get mental health into the law enforcement to themselves? How do we fix the world? Officer Creech.
When you let me know. No. No, one of the things I know our department has done is put a peer support group together. And that consists of every rank, everywhere from, your boots on the ground officer to, sergeants, lieutenants, and captains. And, we're a different breed out there. So it's tough to open up to peers, especially if it's something very personal that we're not comfortable talking about. But a lot of it is just, a lot of us have a very close partner that we might work with, or someone that, hangs out with us all the time. So they know your normal behavior. And I think a lot of that just, we have to check each other. We have to pick up on those signs, and we're just as responsible as anybody else in any other workplace and, in the world. But it's tough to nail it down to just, if we do this, it fixes everything. But I think with these peer support groups, sitting down and talking to officers that maybe went through, kind of a bad call, or experienced something, a death in the family, or a divorce, or a serious illness or something like that, whether it was them or a family member, to recognize that, hey, I know that they're going through some extra stress, and maybe the sergeant doesn't see that, but me riding in the car with them every day, I'm going to say, hey, buddy, let's go grab some coffee, or another code 7. That's our lunch break. And say, hey, let's sit down, what's going on, man? What can I help you with? Is there anything I can do? Do you want to hang out and go do something after work? Maybe they just need to get their mind off of it. But it's in recognizing that, and a lot of the people that are working on the same watches, you get to know these people. When there's an off day. Sometimes it's just, okay, I gotta leave that dude alone. And another time it's, okay, I need to pull him aside and talk to him because something's just not right, and I know they just went through some stuff. So it's just recognizing each other's signs.
Right. And then anybody who's not aware, Copline is a confidential 24-hour resource for law enforcement officers. It's actually staffed by retired law enforcement officers. Sandri and her team do trainings for law enforcement officers. My father actually just went through the process. So sometimes it helps to know that call is going to be answered by someone that has kind of seen what you've seen, because obviously many of us can't even conceptualize what it's like for law enforcement officers. So with that, I'm going to go down to you, Alice. So you are an interesting individual for many reasons, but one of them being that very few people walk both lines of mental health and faith the way that you do. But you initially started when we were talking, you talked, no, I was in the faith community first, and then you've kind of come over to this side. So maybe you could talk to us a little bit about what brought you, in the faith community. Obviously, faith can be a huge protective factor, and there's a lot of strength in that. But a lot of times, mental health, suicide prevention, and the faith community have not always wanted to sit at the table together, to put it as kindly as I can. So what brought you from the faith community to acknowledge that, hey, there's things that we can be doing?
Well, that's a difficult question to answer, but I'd like to start by saying, when I was born talking. And I'm probably unusual in that way, so the rest just falls into place. But there was no stranger. I didn't know that there were people that wouldn't talk to me forever until I was 12 and my father died by suicide, and I happened to walk in and see it happen. And that silenced me. It took my voice away, it took my power away, it took everything away from me for quite a long time. But I meandered through life and acted just as normal as every other kid. I was just silent. And it took several years before I started getting my voice back. And how that occurred is I decided that I was going to be one of the smart kids. And not smart in math, because that just befuddles me, but I started studying about suicide and suicide prevention, and I had little tiny kids by that time. And I just needed answers because one day I knew they would ask me why they didn't have a grandfather. And I didn't know what I would say. So I went to Edwin Schneidman, who's one of the smartest people on the planet, bless his soul, and he taught me how to do a psychological autopsy. And at the time, my senior siblings were all alive. They all cooperated, more or less, and we figured out that from my father, the pain simply overwhelmed the hope that he had left. And that's how I found my voice. Fast forward to 1989, and in my own life, as I was going along, raising my children, going to college, doing all those kinds of things that smart people do, 10 losses in 3 months caused the pain to overwhelm my hope. And I had to figure that one out too. So I decided to go to seminary. I already had a business degree, but I was so bored with it, it wasn't working for me anymore. And when I got involved in suicide prevention and all of that, I found Adventist Health in Glendale, which is a faith-based hospital. They took pity on me and invited me to be part of them. And I've been there for almost 30 years. But there was no way, there was probably no job that I really wanted. I could do plenty of jobs, I just didn't want any of them. So I just created my own again, which I seemed to be able to do. But I had a voice. I knew what I wanted to do, and what I wanted to do was get the community healthier and let them find a place of safety where they could come and work out their loss issues. So that's how that part started. And one of the first things I learned in seminary, not the first thing, but one of the first things, was in class one night, one of our students ramped up her suicidal ideation, and the class got very serious. It got derailed, and my professor stepped up and said, "What is the one thing that you want to live for?" And she said, "My grandchild." And that was the opening, and I thought, how amazing, how smart he was. But then I knew there are words to reach people. So fast forward to what I do today. We have a huge bereavement program and 2 meetings a week for survivors of suicide to come and find their voice because it's been taken from them. I also have a very fabulous emergency department where we seem to be a magnet for people that have suicidal ideation and a lot of pain, a lot of emotional pain. So I find people in the emergency room. I also find people in the ICU because I happen to be an ICU chaplain. And for those that are lucky enough to survive their attempts, I have an open door. And then we have behavioral medicine as well to work long-term with them. So a lot of things started converging. And I loved what our speaker said, our keynoter said, you know, find your place and then get the people around you. I have a ton of people around me. But what I learned also from the smartest people on earth, which I don't know their names anymore, but they said, all you have to do is show up. Just show up. Wherever you're called, just show up. So all of you that want to be heroes, but you don't know exactly how to get there, listen to what appeals to you and then show up. And check those resources that we all have the advantage of having today, but we didn't even have this 30 years ago. Because when I needed it desperately, there was nothing for me. And then again in 1989, it was just so hard to find anything. So it's up to us to make these things available and use our voice.
So as a reverend, as a chaplain, what are some of the things that the faith community, religions of all denominations all face across the board, what are some of the things that they can do to help bring this message of mental health, bring this message of suicide prevention and awareness? Because, you know, again, A lot of times we have this idea of suicide is a sin, and it's, and this, and, the Jesuit church had recently declassified it as a mortal sin because they realized that we were preventing people from reaching out for help. So what are some of the things that the faith community can do, the leaders in the faith community can do, or congregates can do to bring back to their communities?
You just asked the magic question. One of our facilitators in our grief groups lost her daughter a number of years ago, and the very first thing she did was get a hold of someone at D.D. Hirsch, get a hold of her pastor at church, and she said, I have to educate this church, every person in this church, about what suicide is and what it can do to a congregation. She was like holding the torch. I think what has happened, because back when I started, clearly the churches had very closed opinions and very shaming and damaging opinions and judgments on people who die by suicide. That is not quite the same today. And I've done a lot of outreach in our community with pastors and churches. And I say you have to get educated, because sooner or later this is going to be on your doorstep. And if you don't know what to do, call me and we'll work it out together, because I'll put you in touch, and there's resources out there these days. So kicking and screaming, our pastors, our priests, our rabbis, all of them have had to face suicide close up. And they are dealing with it. They are getting educated. They are bringing it into the congregations. So it's happening, not by choice, but by need more. And so the more we talk about it and the more we make resources easily available, and handouts and telephone numbers and names of people to call, all of that has to be at their tips.
Great. Well, we're going to come back, and I'm sure there's going to be people in the audience who have questions for you. Melvin, I'm going to go to Ann, and then I'm going to come over to you if that's all right. So, Ann, you're very open about being a suicide attempt survivor. Great, that'll work. So as an attempt survivor, when was it that helped you to get to a place where you realize, wait, I have a role here too, not just in dealing with my own suicidality and thoughts of suicide, but that I have something that might help impact others and help others stick. When did that shift happen for you?
Well, I've had 4 suicide attempts. The first one was in 2009. The other 3 were 6 years ago in 2012. I sought a lot of help at the time, working with psychologists and psychiatrists and medication. Really couldn't quite move forward, and I was looking for more support, and I found the Suicide Attempt Survivors Support Group, which is at D.D. Hirsch. There are not very many groups that offer this service, and found that. I was incredibly lucky. I joined the support group. I met other people who have also attempted suicide, and I was able to, for the first time, talk about my experience, talk about my pain, talk about what it felt like, share experiences with each other. I felt like I couldn't do that with friends or family. There was a lot of shame, a lot of stigma. I kept to myself until I found this group. So I'm very lucky to have found that. Sorry, I'm getting a little emotional. Then, as being a part of that group, I was invited after a year and a half to be a facilitator, a peer facilitator for that group. So I have done that for about a year and a half now. We have 8-week cycles, so anyone who's attempted suicide can come in and share their experiences for 8 weeks, and then we take a break, and then we start up again with new members or the same members again. And gosh, to see the people transform and morph from people who can't share it all and who feel so stigmatized, it's huge. So I felt like that was a big turning point for me. Also, at the same time, I was invited to be a part of the S Word, which Lisa over here is the director of the S Word. It's a documentary based on suicide attempt survivors and also loss survivors. It talks about our experiences and our dreams and our hopes. And I did an interview with Lisa and her husband, Doug. I didn't confirm that I wanted to be a part of this movie yet, but I said I would go through the interview, and I did. And for the very first time on camera, which was going to go to other people, I was able to talk about my experience and to say what it felt like, and that was so empowering. I think as an attempt survivor, you feel like you can't share, you feel like you can't talk, and this was the first time I really felt in front of a public eye or in front of people that weren't part of that support group. I was able to share, and I felt proud and I felt brave, and that was a huge turning point for me, was speaking up and owning what had happened and realizing that I was not a bad person for doing this. So that was a big turning point. And then after that, I moved into, I still peer facilitate this group, but I moved into working as a crisis counselor for the National Suicide Prevention Lifeline through D.D. Hirsch, the Suicide Prevention Center. I do that to this day, and it's amazing. Anybody can go through the training and can become a crisis counselor. Anybody who has the ability to listen and to offer support, and that's all you need to work this, to be able to listen to people's issues and their problems. And so I do that, and I feel like as somebody who has attempted, I feel like I can relate. I don't understand completely everyone's situation, but I feel like I can relate to the pain. I've been there. Devastating, and to listen to people talk about what they're going through and how they don't have this will to live. It's heartbreaking, but it's also heartwarming that I know that I can listen to them. I never share my own experience, but I know I can listen to them and I can guide them in such a way that they can maybe have a little bit more hope, find something that they want to live for, and it's effective. Suicide hotlines are effective. I don't know. I don't know what happens after our phone calls. I don't know if they survive or they don't survive. I've got so much Kleenex. So you never really know what happens with people, but I have a good feeling that maybe 80 to 90% of the people end up surviving. So that's my story. Yeah.
Great, thank you. Yeah, please. I just want to hit on one thing, and then I'm going to turn it over to, with you, Melvin. But one of the things that I find working in the field is that we need more attempt survivors coming forward. We also need more people acknowledging and bringing more people in who have had thoughts of suicide, but that never went through with an attempt. That's a voice that often gets missed. Like what we can learn so much from that experience. I'm willing to bet if we go around the room that me and you are not the only two people in this room. I can guarantee we are not the only two people in this room who've ever thought about whether we should stay or go. And I think we need to, normal's not the right word, abnormal's not the right word, whatever word fits in between those two, but I think because we don't talk about attempt survivors and our thoughts of suicide or whatever, I think we've created this situation where we think that everybody who's thought about suicide or attempted suicide is this fragile piece of glass that we have to hold with baby gloves for the rest of our lives. And I think the more that we start to, yeah, I thought about it, so what? Like, what is it to you? So what do you think, what would be your message as far as other people coming forward with their story? And obviously, there's a lot of consideration that people want to give to it, because people might, if someone is in law enforcement, that there might be some professional ramifications. Someone's in the military. But what are some tips for other people who have lived experience around suicide, and what's the role that they can play? And it doesn't have to be on a stage like this. Sometimes it's in their personal lives. Any tips about how people can utilize that?
I think it is, I feel very blessed. This might sound very off, but I feel very blessed that I have been through that experience. And yes, it's true that people in this day and age are susceptible to losing their jobs if they do talk about the fact that they've had a suicide attempt. So many people do keep quiet, but I would encourage trying to reach out instead of hiding and isolating, but trying to reach out and talk to people and ask for support and ask for the help that you need and ask for someone to listen and tell them what you need. Also, finding someone else who's been in the same situation through a support group or, I don't know, somehow a friend or somebody else who's been in that situation, and to talk about it and to share that experience and to know that you're not the only person in the world that's actually attempted. It makes you feel like you are okay and that you have support and that you have teamwork. And giving back, doing everything you can to give back. That's how I feel. I have turned many of my suicidal thoughts. I do still struggle. Every day I have suicidal thoughts and I think about it. I feel like I'm safe, but turning those suicidal thoughts that you have and your experience, sharing that, being open about it, and people will come to you. I post things on Facebook. I use social media, and I post things on Facebook, not too often, but every once in a while, and all my friends know that I have attempted suicide, and it's amazing how many people have actually messaged me or contacted me via text saying, hey, my daughter's really struggling, what do I do, and asking for resources and references. So it's amazing how many people struggle. They really want to talk, and they don't have that ability to do that.
I think what you're doing, sharing your story, is helping people talk. So thank you. All right, Melvin Jackson Jr., thank you for being patient. So people have read your bio here. It's impressive. They've probably seen the projects you've worked on. There's a very important part of your history that brings you here today that is going to be news to people. So I want to, if you wouldn't mind sharing a little bit about that. And then me and you know what me and you are going to talk about afterwards. So go ahead.
Well, 4 years ago, after talking to my father on the phone, he was going through something, didn't know what mental status he was in. But an hour later, I found out that he had committed suicide. And so I didn't know how to deal with that. I thank God that I was in church when I found this news out, and my church members rallied around me and lifted me up and supported me. And through that, I was able to survive the hit of dealing with a loss of my father and knowing that I can no longer call him anymore. Someone I talk to every day who I share the same name with, and just not understanding why. Why did this happen? We talk about everything, and why wasn't this something that he was comfortable talking to me about, the state of mind he was in that moment when I was there. And then my question to myself was, did I do enough? Then I started blaming myself. Oh man, I should have stayed on the phone with him. I should have prayed with him. I should have done more. And I now understand that sometimes you can do as much as you can do. In the close relationship that we had, there may have been nothing that I can do, but now there is something that I can do for people that are going through situations that I now have to ask, how are you really doing? Instead of just saying, hey, how you doing? It's like, no, how are you really doing? Is there anything I can for you for? Anything I can help you with? Can I be there for you? Because had it not been for my support team, I probably wouldn't be here, because I too wanted to take my life, because I'm like, I don't want to be here. I'm hurting too much. But I had 3 sons to take care of, and I had older responsibility to them. So I just felt that it's a pain that never goes away, and this is my healing process. This is how I heal, and this is how I make a difference in the world, by telling people the story and helping people going through it, because in the African American community, as men, we don't talk about this at all, and it has to stop. And so I feel like God is using me to help that movement and to talk to my sons about how they're feeling mentally, if they're depressed, so that we can have an open dialogue.
Well, you hit on two cultures. You talked about African American men, but I think sometimes we forget that us men are our own culture, and we are the ones who are disproportionately affected by suicide. We represent so much of the number, so much of the percentage. So I just want to thank you as a man for speaking, using your platform. You know, many of us don't have the platform that you have, and for you to come forward and talk about your loss, but also in front of all these people too, and say, yeah, I've been there too. Kind of the attitude that I had, yeah, I've been there, so what? You know, that's where I was. Now I want to ask you a question. So, because we were talking the other day, we've talked a few times prepping for this, and something that we in the suicide prevention field do, unfortunately, far too often is we criticize other people within our field for the terms they use or the things they say, and say this word, don't say that word. At first it was don't say committed suicide, and then it was don't say completed suicide, and eventually we're going to run out of verbs that we can or can't use. And so we say died by suicide and attempted suicide, and part of that is out of respect. And as I was talking to him, I was introducing him to this terminology. And kudos to you, you called me a couple days ago and you're like, I'm going to say committed. And if you don't want me to say committed, like, we'll figure it out. But you felt like you weren't being authentic and you weren't feeling real if you didn't use that word, because that was the trauma that you experienced. And you kind of had a point of, when we don't use the word committed, and I'm sure many of you are familiar, associations, crime and sin and whatnot, you felt like we were softening the blow a little bit. And you don't want us to soften the blow. This is one of probably the worst thing, if not, one of the worst things that happened in your life. So talk to us about that. What was that thought?
Well, I feel that, it was brought to my attention saying don't say committed because it's, makes people feel bad. It makes it feel like a crime. It is a crime. You committed a crime against yourself. So forensics, people have to come out there, bag everything up. The suicide note has to be bagged up. People come out there, draw a chalk around the body. Everything that you do if you kill somebody is the same thing. So why should, therefore, we put a bow over it to make it pretty? It's not supposed to be pretty. It's not meant to be pretty. I'm not going to make somebody feel good about thinking about it or make it feel good that they've gone through it. We have to understand that, yeah, we're not here to try to prevent somebody, but we're here to tell them that you can live. You can find something to live for. And I feel like I would be doing a disservice if I therefore say die by suicide or that doesn't flow out my mouth as well as saying he committed suicide, she committed suicide. It is what it is. And I think in this society, we get so caught up in trying to make everybody feel comfortable. No, this is something that we can't be comfortable about because it's something that affected me, still affects me, and will continue to affect me. So I'm not going to apologize for saying committed. I'm not going to make somebody feel a certain way because I said everybody is entitled to their own opinion. There's the rights, freedom of speech. If you want to say die by suicide, so be it. But that's not the terminology that I choose to use, and I feel like it doesn't speak for me authentically, to be authentic.
I appreciate that. Because I think a lot of times we're so worried about it. We're so worried about saying the wrong thing, then we end up saying nothing. I had a friend of mine when I was in college, and oh yeah, thank you for the reminder about time. I'm gonna gracefully decline the time, and I'm gonna go over just a little bit. I see you though, and I acknowledge you. But he was in a wheelchair. And to be honest, I never really interacted on a close level with someone who dealt with paralysis. And until he gave me the space to say, ask me all your questions, use all the wrong words, and I'm gonna tell you what that was, I wasn't able to see through that lens, and I wasn't able to have critical thinking and conversations. And now I'm so much more aware as I walk down a sidewalk and I see this sidewalk, what's going on? Why isn't this paved? And so I think it's good that we have conversations about words, but it's also, at the same time, it's important that we just need to get in there, and sometimes we need to get our hands dirty. Tracy, how are we doing on cards? Did anybody raise their hand with some cards, some questions for our panelists? We got a couple here. There's a gentleman in the back. I'm probably going to have to stand for this part.
I want to just say something too.
Yeah,
With
please.
being in the industry, as you see, it doesn't matter how much money you have, how much fame you have, it affects everybody. There's no one that's immune to this epidemic. It is what it is, and we have to do our part in making sure that everyone feels love, everyone feels like there's someone that cares about them. We're always in our phone, we're always texting, we're not paying attention to when someone's talking. That matters. Someone could be telling you they want to commit suicide right then and there, but you're on your phone looking at Facebook, Instagram, that you missed the whole situation.
How are we doing, Tracy? We're great. All right. Tracy's making her way. Oh, yeah, thank you. I don't know. We'll get to that in a second. Jim the Hat. You're Jim the Hat. Have you come that suicide stigma is global? So is the question, is this an American issue or is this a global issue? Is that what you're okay. Anybody on the panel have any thoughts? Is this something that we're just dealing with here? I mean, I have my own opinion, but this is your panel.
I would say nothing.
It's right now. It's on. Now try it. It just did it when you did. No, try it.
Again? Oh, he fixed it with his finger. He pointed and it worked. He's a miracle. It's absolutely global because one of the gals that sits in my Survivors of Suicide group is from Taiwan. And that's only one place in the world where suicide is silenced. It is shameful and you just don't talk about it. And she's Americanized, and she is now very young, very accomplished, but having to mediate in her family to get it discussed because suicide happened in her family. So I know for sure it's everywhere. It isn't just in LA.
It's not, and what's impressive though is looking around at other countries and seeing how they changed the conversation around stigma around mental health, stigma around, conversations around it. Another issue here, as Ellie talked to earlier, was the issue of firearms. America is often a firearm community, and just that significant access to means. So this one I assume is probably more towards you, Ann, but anybody please feel free to answer it. It says, I'm a suicide attempt survivor, but I've also had many friends who are at risk. How do we balance taking care of ourselves while helping those who need help?
Wow, that's a really good question because it is important to take care of yourself. And sometimes it is very overwhelming to hear other people's stories and their needs of suicide. For me, their needs of wanting to attempt suicide. For me, it helps me to talk about it and to help other people and to say, hey, this is what I'm going through. Let's talk about it together because we're both feeling the same thing. And I would encourage you very much to talk to that person. Yes, you do need to take care of yourself, and it can be triggering, and it can bring up thoughts. There are in the media just recently with Kate Spade and Anthony Bourdain. I think it triggered a lot of people who do have suicidal thoughts, including myself. It's hard to hear and it's hard to see, and in the media sometimes methods are brought into play, and someone who's feeling suicidal, that is very triggering. So it is important to take care of yourself and talk to somebody. A professional is what I would do, is speak to a psychologist and let them know what you're thinking and what your thoughts are. Yeah.
Okay. You're all looking like you might want to jump in there, and I wasn't sure. So this is probably more of a question for you, Ellie. So if you want to come back, you don't have to. It's up to you. I'm going to try to answer it, and then you can come up and tell me all the things I said that were wrong. To the keynote speaker and Stan, and interested panelists. So pretty much anybody. It's a free-for-all. How will the new CDC data that mental illness is not as big of an issue as we used to always say 90% of people, and Ellie and I are going to talk about messaging in a little bit, change what organizations do for suicide prevention? And for me, I'll just answer briefly. You all remember the game Jenga, the board game Jenga, and it's a bunch of blocks and you stack them up top. And then you pull out the blocks, and then the person who pulls out the last block that causes the whole tower to fall, it's their fault, right? They're the one who lost the game. That block caused the entire tower to fall. And for a long time, I think that we've thought that blamed mental illness is that last block. And we've wanted to say, oh no, it's just mental illness. But we're not always looking at the rest of the conversation, that there's a whole foundation going on. And I think for us, for me, I think that it's going to open people up to realize that we got to spread the breadth of the conversations that we're having around suicide. That there's a lot of men out there who would never go see a doctor for mental illness or symptoms of mental illness, but they're having thoughts of suicide. Okay, maybe I will reach out for help around that. I don't know if you want to answer. You don't have to. I'm kind of putting you on the spot, but I'm not really. I don't know if anyone else here. You're coming up. There you go.
I do want to clarify that people didn't have a mental health diagnosis at the time of their death. So mental health services are a really important puzzle piece. And there's a lot of work we can do to improve access, improve the quality of care. But I think what it points to, and it's so great to hear some stories of different kinds of supports, it really takes the whole community. And it's great to hear some stories of peers, just listening to each other, helping each other out. Your peers maybe are the ones who can detect when you're really struggling. So I think there's that upstream piece of supporting people when they're going through any kind of tough time. And then midstream and downstream, we do want to connect with professional resources if people are suicidal, if people have lost someone. But it takes more. It's not just the mental health people that are going to take care of this, right? It's all of us. And I think that data helps us take it away from just a clinical issue and own it as what we all as people can support each other with.
All right, and that's a good segue, actually, to this large board that I was handed. So you'll see this on the hallway. Did they get handouts as well, or just, you also have handouts? But again, the hope is that we don't just come here and say, I went to a conference, I learned a couple things, and I feel better about myself, and I feel better about the world. We want you to go out into the community and do things. So you have a handout, but on this board, just some of the things. The LA Suicide Prevention Network that has been in existence for a while now, that annually plans this summit, is going to be expanding, and we're inviting you to come join us. So if you want to come join us, if you want to join a subcommittee around data, around media, around messaging, around schools, please, in your eval, it'll give you a little area where you can put your email down and say, yeah, I want to join. As you're going through, come to the messaging workshop, to shamelessly plug my own workshop, and as you're moving forward, make sure that the messages that we're putting out there are responsible. Look around in your own community, to your school, to your workforce, to your human resources department, and see if we can host a training around suicide prevention. For means restriction, at your local pharmacy, are the pharmacists trained in suicide prevention? There's a pharmacy bag activity that we did a few years ago that included crisis information to put on pharmacy bags. Promoting gun safety around means restriction, gun locks and gun safes and such. So there are a number of activities that each of us can do leaving today. But I would say this, I made a note earlier, and I think the two most important things, one of which we just hit on, is take care of ourselves. Being okay to ask for help ourselves. Mental health professionals, educators, law enforcement, you are the chosen people. But make sure that you are there tomorrow to take care of the next person. We have to be willing to say that we're not okay. And the second thing, as much as these conferences are important, as much as attending a training is important, as much as being properly trained in risk assessment is important, I still believe that the most important conversations we will ever have around suicide and suicide prevention are the ones we will have on the couch, the ones that we will have on the phone at 3 a.m. in the morning, the ones that we will drive through the night to be with a friend, not because we have the answers, but simply because we want to say that we are there. So with that, I'm going to turn it over to Carolyn. We're going to take a little break and go to the workshops. But before I turn it over to Carolyn, just one huge round of applause for these brave, heroic individuals up here. Thank you very much for being here.